We're back, and I'm back with Dr. Margaret Kilibwa. Welcome, welcome, welcome. If you're just tuning in, you are watching a night of celebration. We're here raising funds for Tropical Clinics, and we are here with its founder, Dr. Margaret Kilibwa. Kilibwa, I apologize. I just ate something, so my mouth is not moving right. Dr. Margaret Kilibwa. We're raising funds today to help transfer a container full of medical supplies. We need $15,000 to transport that container to the people in need in rural Kenya. Dr. Kilibwa, thank you again for, you talked to me before a little earlier, but thank you so much for coming back up.
Well, thank you so much, Dino, for promoting our work and sharing it with the audience and letting them know about our urgent need and also to become part of our movement to save lives in rural Africa.
Why don't you tell us some more? You talked about the urgent need. Tell us about Tropical Clinics.
Okay, Tropical Clinics. At Tropical Clinics, our goal is really to create model healthcare. And what I mean by that is we want to be the place in rural Africa, in rural Kenya to start with, where someone being even 5 to 10 miles away can say, if I go to that clinic, I'll get the type of medicine that I'm looking for. If I go to that clinic, I'll get the type of treatment that I'm looking for. If I go to that clinic, they will not turn me away. If I go to that clinic, that is where somebody's going to really take me by the hand and want to know more about me. That's the type of care we want to be, and that type of treatment center we are promoting in rural Africa. So this urgent need of us of getting $15,000 to get the treatment center, the medical supplies they need, will allow us to do that, to become the model treatment center for a lot of people in the area.
And when you say urgent, you definitely mean urgent, because you have to raise these funds by April the 16th.
It is absolutely urgent. If we don't do that, there's several things that are going to happen. If we are not able to get the container from storage, we are now increasing the amount of money we have to pay for storage. And that is number one. So now we're going to need to raise even more money to pay for storage. And that money could go into saving lives in rural Kenya. Right there, if we don't get the container to the treatment center, the physicians, the clinicians, the advanced nurse practitioners, they have no supplies to use. So we can't have a container sitting in a storage when it could be doing work, saving a lot of lives. So this need is very urgent for us.
Yes, and right now you had a grant from Johnson & Johnson that helped to gather the supplies and help to pay and fund for a majority of the supplies. Is that correct?
Yes.
Yes.
Johnson & Johnson gave us a grant. Then we partnered with Project Cure that really sourced all the medical supplies for us. And just for our audience to know, we have microscopes, X-ray machines, hospital beds, bathing equipment, dental equipment. So we have really major equipment on this container that do not exist in some of the major hospitals in rural Kenya. So if we can get it to the center, we will be offering this particular community a lot of services that they cannot afford to get right now because they don't have the equipment.
And you also have some of the supplies that we wouldn't even think that a hospital or any kind of medical clinic would be in that dire need of: surgical masks,
right,
and testing kits for HIV,
yes,
and pap smear kits,
yes,
and what other some of the other things that these people are in need of there?
When you think about it, a physician here going to a patient room, you can't imagine that they won't go to a patient room without a stethoscope.
Yeah,
it's second nature to them. Yet in Africa, in rural Kenya, it is very difficult to get a stethoscope. We have stethoscopes on the container.
Wow.
So this is just so amazing that we have these supplies, and now the clinicians and the advanced nurse practitioners will have this equipment to use. And again, it is taken for granted here that you have a stethoscope, you have just a mask, an oxygen mask even. I have an incredible story to tell also. I visited one of the local government centers in this particular community of Kakamega. And This was like my second visit to the area when I was doing needs assessment.
Uh-huh.
And I was so shocked and really touched me and made so much more for me to want to do this work there. In one of the surgical rooms, they couldn't operate on a patient because they didn't have oxygen masks. They just could not afford to have an oxygen to give a patient. Guess what? The patient ended up dying.
Wow.
Because they could not afford to have an oxygen mask for the patient. We have oxygen masks on the container. So that makes it just so much more important for us to get it to our clinic. And we may, if we have more than we need, we may even be able to help the medical center, the hospital, the government hospital, by donating some of what we are not able to use to them so that they can help the people coming for care in the area.
Now, you started the clinic back in 2005. Can you share some more stories of some of the people that you have encountered in starting the clinic and that you've met as patients and so forth? Share some of those stories with us some more.
Oh, there's so many stories to share, really, and there's such encouraging stories. I've met stories of women who have never been, they've had some pregnancies before. Fortunately, they were able to deliver without a lot of issues, but they've never been to a doctor for prenatal care. So we give them prenatal vitamins for the first time, and they are thrilled. They're so amazed. I have a very interesting and very good story for me. When I tell this, I actually chuckle. When we did, it was during the second year of our triage type of clinic. So I go in and I take a lot of prenatal vitamins and prenatal minerals for these women. And one of the women in particular, I give her enough to actually get her through the third trimester. I went back the following year, and she gave me such a beautiful story of giving birth to such a big baby. that actually, the doctors were amazed. They were asking, "What did you do? How was it?" And she was telling them, "Oh, there's this lady, she's building a clinic here, and she gave me some really good vitamins and minerals, and now I have a healthy baby, and a baby who weighed bigger than a lot of the babies in the area." So it was a great story that, it only takes vitamins and minerals to actually get a proper birth weight. Can you imagine vitamins and minerals?
We laugh, but it's we take that for granted living here in the States.
Exactly.
We take for granted that when we get pregnant, that everything's going to be okay.
And you will get your
prenatal. You'll have your prenatal vitamins.
Right.
Your child will have all of the proper care once your child is born.
Right.
That you are going to deliver in a beautiful, clean facility.
Right.
And that's not the case.
It's not the case there. So it became a huge story. And she actually said that she's going to be one of our frequent clients at the clinic, because she said, if I could do that to get a big baby like this and a healthy baby, look at how much more I could to live longer.
Yes. But I mean, look at what she's doing then to help the people in her community, the women in her community, that she's giving them hope and inspiration in the same way that you've given hope and inspiration to those people out there. Yes.
Exactly. So
and not just you,
Yeah.
but all of the people that help you
Right.
and support you.
Right.
So it's a wonderful thing, and I'm so glad that we're here today, and I think that we're... Oh, sure, yes. Phases. There are phases. Talk about the phases of the clinic.
Yes, I recall when we talked earlier, I mentioned to you my goal was, when I founded Tropical Clinics, was to go in and build $1 million medical center. And then I learned the hard way. Sometimes you got to learn about the process and learn about your work and who you're going to support before you really get there. So the triage type of work that we've done has been incredible. So after I found out that we couldn't raise $1 million right away to build a medical center, I decided to take Tropical Clinics in several phases for us to get to the medical center. The first phase was to do the triage type of clinics, and so we could learn about the ailments, the community would learn about us, and that we would really get to be accepted in the community, and then use that work really to build our foundation. And that work has been completed. It took us 5 years. We've treated about 4,800 people. So we've completed that phase. We are now in second phase of our process of building Tropical Clinics. And here is where we've rented and renovated a treatment center. It is all done. It's an 8-room, beautiful facility. It's all done, ready to go. And the urgent need we have now of getting the medical supplies from the port to the treatment center, we'll now have a treatment center running on a daily basis. Wow. So we expect to run the treatment center for the next 2 to 3 years, and then go to the medical center. We won't wait. We will keep talking to different people about building a medical center, and if we can get sponsors, and we are looking for that too, sponsors to come and partner with us so that we can build a medical center. We know from the architectural analysis that we did, we're going to need about $1.5 million to build the medical center. So we will run the treatment center. It is a great way for us to build a foundation, a stronger foundation, even the triage, because now we're going to be seeing most of the people on a daily basis. We can follow them and document their treatment. How far they're going? Are we making a difference? Are we making an impact? And then carry that work from the treatment center to the medical center. So once we build the medical center, then we have a model. And from there we can expand to other regions in Kenya, and then also to other areas in the area as well, like to Uganda or Tanzania as well.
Now your work was fueled by the urgent health crisis that's going on in Kenya. Can you talk a little bit about some of the health issues that impact the people there in Kenya, about AIDS and some of the other things that they have?
Sure. Right now, as we speak, about 5,000 people are dying of HIV every single day. If we can do anything to prevent the death and give people quality of life, we would have impacted these people in a big way. Because we've known now the people who are taking HIV medication, and if you treat them without the stigma of the HIV, they become really productive people in the society. We want to make that impact. So we can prevent 5,000 people, help prevent 5,000 people from dying from HIV and AIDS-related disease. We know right now 40% of children in this particular region and in rural areas of Africa and in Kenya in particular are dying from malnutrition. If we can help prevent this, we will be building the next generation. That will be a healthy generation. As I said earlier, there is a lot of prevalence of hypertension and prostate cancer. We would like to be able to prevent that as well. So we're going to be doing a lot of screening and a lot of prevention.
Yeah. All right. Well, I think that we are getting ready to hear some wonderful music by Hannah Zeg. Thank you again, Dr. Kilibwa, for talking with us again and sharing your stories. And you out there for joining us. Continue, stay with us, donate. We need $15,000 urgently, and we can't do it without you.